My name is Amna Tasir and my group fellows are Javeria Khalil, Dinta Ihsan and Tayyiba Usman. We are the students of Pharmacy Department in the University of Central Punjab, and today we are going to discuss on the topic insulin. The points that will be discussed in our project presentation include the origin, chemistry of insulin, route of administration, pharmacokinetics, pharmacodynamics, clinical uses, side effects, toxicity, its treatment, and brands. Talking about its origin, as we know, insulin is a natural hormone secreted by the cells islets of Langerhans. Firstly, these cells were discovered in 1869 by the Paul Langerhans. Then in 1889, Oscar Minkowski and Joseph Vaughan discovered that the removal of pancreas led to diabetes, where in 1910 Sir Edward Albert elaborated the discovery by only one chemical was missing from the pancreas whose absence caused the diabetes. First time in 1921, Frederick Banting and Charles Best, by using the labs and the dogs, Professor McColl extracted the insulin from the dogs' pancreas, and with this insulin they kept the diabetic dogs alive for several days. In 1922, James Collip purifies the insulin extracted from the cattle, and the first experiment was performed on the 14-year-old Leonard Thompson, suffering from the type 1 diabetes on 11 January 1922. Glucose level drops down, but allergy reaction occurred. Then more refined form was produced, and the second experiment was performed on 23rd January 1922, which was a successful experiment. In 1936, Novendix. In 1978, first genetically engineered insulin was produced by using the E. coli bacteria. Genetically engineered insulin was produced by using the yeast Saccharomyces cerevisiae. Eli Lilly went in 1982 to sell the first commercially available biosynthesized insulin. Moving forward to its chemistry, porcine insulin differs from the human insulin at 30th amino acid of B chain, while bovine insulin differs at 8th and 10th amino acid of A chain and 30th amino acid of B chain. Insulin obtained from the cattle is called bovine insulin, where the insulin obtained from the pig is called porcine insulin. Pre-proinsulin is converted into the proinsulin by proteolytic action in the endoplasmic reticulum by the signal peptidase. Proenzyme is converted into the insulin in the Golgi apparatus by the endopeptidase. Pre-proinsulin contained amino acids 110, proinsulin 74 amino acids, mature insulin 51 amino acids. Then comes the route of insulin administration. We can classify them into the two basic classes. The first one is the practicing route, which includes the subcutaneous route and the transdermal route. Then comes the non-practicing route, which are the ones that are not used in our daily life but are under the clinical trials. They include the oral route of insulin, intranasal route, intraperitoneal colonic insulin delivery, stem cell therapy, intratracheal, implanted insulin producing cells, and beta cell transplant or pancreatic transplant. The insulin oligomers dissociate into the monomer units before dislocating across the capillary endothelium blood circulation. Insulin circulates before binding to the insulin receptors to facilitate the glucose uptake into the cells, into the myocytes. The rate of absorption is increased by the exercise of the injected area, local massage, temperature, and site of injection. In case of oral insulin, its bioavailability is 0, where if we discuss the distribution, we will come to know that it is distributed throughout the body, some attached to the antibodies and some moves freely into the plasma. Less than 5% is bound in the plasma, and the volume of the distribution is 15 liters. Insulin glargine is metabolized by the sequential cleavage at the carboxyl terminus of B chain. Out of the total renal clearance, 200 ml per minute, 60% occur by glomerular filtration, where the 40% by the extraction from the peritubular vessels. If we came across the pharmacodynamics, we came to know that the insulin acts by directly binding to its receptors on the plasma membrane of the cells. These receptors are present on all the cells, but their density depends on the type of the cell, with the maximum density being on the hepatic cells and adipocytes. Insulin receptor is a heterotetrameric glycoprotein consisting of two subunits, the alpha and beta subunit. The extracellular alpha subunit have insulin binding sites. The beta subunit, which are transmembranous, have tyrosine kinase activity. When the insulin binds to the alpha subunit, it activates the tyrosine and causes the translocation of glucose transporters from the cytoplasm to the cell surface. These glucose transporters allow the influx of glucose from the blood into the cells and reducing the blood glucose level. Then moving forward to the types of insulin, which include rapidly acting insulin, regular insulin, intermediate acting insulin, long acting insulin, ultra long acting insulin, and inhaled insulin, which have different onset of action. Insulin is used to treat a number of diseases including diabetes and its acute complications such as diabetic ketoacidosis, hyperosmolar hyperglycemic states. Its side effects include hypoglycemia, weight gain, swelling in the arms and legs, hypersensitivity, lipoatrophy. Severe side effects include the heart failure and blurred vision. Moving forward to its toxicity. As we know, it is not the thing that makes the poison but the dose. So, like other medication, the dose of insulin should also be regulated. Dose of insulin depends upon the calories consumed and the weight of the body. It is simply defined as getting too much insulin to the point of causing low blood sugar level. The condition caused by the insulin overdose is called hypoglycemia, which is manifested with the blood glucose level lower than 3.3 mmol per liter. Its treatment can be classified into the two classes. The first one is non-pharmacological, which includes the internal supplement like the quick supply of dextrose, including the sugar lump or toffees, where the pharmacological treatment include the IV dextrose treatment, glucagon, and hydrocortisone. The brands of insulin includes the Actrapid, Actrafene, Afrezza, Humulin, Novolin, and Novolin R.